I could have been in the hospital. And that's what I'm trying to avoid. And I probably would be in the hospital if it hadn't been for the Monogram.
So Miss Jenkins had called into Monogram, and she got to talk to the Monogram Health FIRST nurses, and she was concerned because she had been told by her primary care physician her potassium was high and she needed to go to the emergency room.
I have COPD. My kidney function is low. It's only at 30%. Call Monogram Health FIRST. That's who I called.
She needed to know what was the urgency that was being expressed to her by her primary care. For Miss Jenkins, having a high potassium, it can be deadly.
People can get really, really sick or worse from something as serious as a high potassium that you can't feel until it's too late.
I said, I can call in the medication that will help get rid of the potassium. I called the pharmacy. They had the medication in the pharmacy, and then we made sure she got it delivered to her home the next day. Dr. Naeem knew about the patient's high potassium, that I had treated the potassium, and she also said I will go into the patient's home the next day to make sure she's okay. So not only did she get to talk to me several times, and I talked to the pharmacist, but we also had a nephrologist going into the home to see the patient, hands and eyes on the patient to make sure she was feeling okay, and knowing that a physician was coming into the home to check in on her also was very reassuring for her as well.
When I was in the home later that day, able to go through her medications with her, able to go through the foods that were contributing to the potassium, kind of walk her through why this is really important in person. Just looking around her kitchen, there were oranges that are very high in potassium. Okay, well this contributed. Okay, let's back off on this one in particular.
The next day, I confirmed with the patient that she had the medication, which she did, told her how to take the medication, and I told her we would be following up with her primary care to get a potassium rechecked, and it was rechecked the next week.
Regina's a perfect example of being able to pull in those other resources to keep her healthy and safe and out of the emergency room and out of the hospital.
Going through Monogram, this has helped me a lot. I feel better and feel secure. It makes you feel secure with them checking in on me. And I like that. There was a point that I would panic, but because of the medication, prevents me from having to go to the ER.
Just being able to keep them in their home, keep them feeling good, but also making sure that we're staying healthy over the long run.
We have a 24/7 service. The physician is on call every day, and there's a nurse there even holidays. Knowing that someone's going to respond to you and call you immediately is what our patients rely on, and that's what we do at Monogram.
What we did for Regina with Monogram Health FIRST happens across the board every single day with all sorts of people with all sorts of problems. We have it on magnets, on their refrigerator. Call us if you need anything.
Patients who are like me, they need to contact Monogram because they can help. With Monogram, I never feel alone. I don't. I'm very happy with Monogram.